Good evening, and thank you for coming tonight. We are live from City Hall Council Chambers, and my name is Julia Newhall. I am the manager of the Substance Use Disorder Initiatives Office. This meeting is to define and clarify what it is that our office does at 437 Revere Street, and also open it up to the community to answer any questions you may have about our new expansion of the said office. I'm going to start the meeting by explaining what it is we do at the said office and hopefully clarify our role moving forward. So SUD stands for Substance Use Disorder Initiatives. Our office was recently launched last Thursday. The SUD work in the city has been taking place prior to the expansion of this office, but this office gives us the capacity and the bandwidth to really address the substance use issue at the local level. The mayor took office last January and prioritized this issue as one of the things he planned to work on when his administration started. And we were lucky enough to have a leader who really wanted to see this work expand. And so our next steps in doing so will be to really create a strategic planning process for addressing this issue at the local level and the regional level. We at the SUD office follow a continuum of care model, which includes everything from primary prevention, so hopefully decreasing or reducing age of onset for youth, all the way up to the recovery level to help people acclimate back into the community once they find their way in terms of their own recovery. We subcontract direct service providers who staff our weekly drop-in center on Tuesday evenings from 5 to 8. They provide a number of different services, which include anything from opioid overdose education to treatment navigation, peer recovery support services. But I want to emphasize that the 437 Revere Street location is not a treatment facility. Rather, it is a city office that aims to address the SUD issue through policy and system changes. And we don't work in isolation. No one organization or agency could effectively address this complex issue on its own. We rely heavily on our cross-sector partners, which include the Revere Police Department, the Revere Fire Department, Revere Public Schools, as well as local treatment providers, those who are personally affected by this issue, the recovery community, and many others. And part of our plan moving forward will be to reconvene our leadership committee come November 16th. From there, we plan to open the process up to community members who are interested in participating in the strategic plan and want to really help us shape where this work is going to go, because as the community, they have the best understanding of what the needs are, and we hope and welcome any input and feedback from especially those who are affected by the issue. So that includes people who may be actively using, as well as parents and others. Our office is always open from normal business hours. We welcome questions and feedback, and we really look forward to working with the community. I think in time we will become a positive and hopefully beneficial support system for the community. And it's important for the city to address stigma by really focusing on the fact that this issue exists in this community, and the only real way to address it is to start to accept that and realize that, and hopefully through collaboration and a transparent process, we will gain the support from the overall community as well. So I'm gonna go around and introduce everybody, but first I'm going to hand it off to Mayor Arrigo. Want to switch?
That's okay. All right, that's good. I can scoot over. Good evening, everyone. Thank you for being here this evening. I especially want to thank Julia for the work that she's done. And as she mentioned, since I took office January, we knew a couple of things. We knew that there were a lot of great people who were dedicated to seeing the problems of addiction be addressed in the city. And we had a great kind of core group of individuals who cared a lot about this work. And being someone who's in the age bracket that has been most hit by the epidemic, this is something that, as Julia mentioned, was one of my priorities upon taking office, was addressing this issue. And one of the things that we saw as a little bit of a weakness was coordination for the city. And Julia has done an incredible job in terms of being that point person for the city. But what we did was also a couple of other things. We added staff, so we increased our staffing levels. And we opened the office on Revere Street. And today, we're hoping to address any concerns that individuals in the community have about the opening of that office, because there has been some conversation about that. And anytime there's something new, people kind of always assume the worst. So as Julia laid out, the office on Revere Street is not a medical facility. There is no medical treatment happening on site. It is an office for city staff that are dedicated to, at the end of the day, making sure that fewer people die from addiction. And I can't imagine a better use of our time or energy or resources. And so there is one night a week where there's a drop-in center. I believe it's Tuesday nights. And that is the same drop-in center that has been in operation since 2011 on Beach Street. And that is the same drop-in center that has had zero safety concerns or calls for service in terms of kind of the crime or potential for bad things to happen. So just to put that in perspective, this is the same exact operation that we've had, just in a more visible location, in my opinion, and I think that's a good thing for the city. And Julia mentioned ending the stigma, and how it's kind of a hot slogan to talk about, and I think we're actually seeing the stigma live in our faces when we talk about the concerns that people might have about this office. So it's important that ending the stigma, it doesn't just end up being an empty slogan for us, and that we have to live by our actions and not just our words. And so when we talk about ending the stigma, we have to back it up with our actions. And the city's, in my opinion, and I'm lucky enough to be the mayor, in my opinion and in my actions, I'm backing up those words by saying we're going to put an office out front on Revere Street, and we're going to have city staff and additional city staff focused on this problem. And so from my perspective, I think it's easy to give lip service to a problem, especially a problem that is easy to give lip service to because it's so well publicized. And it's one thing to have events or to have press conferences, but it's another to have the actions backed up by those words. And we have to make sure that we're not just giving lip service to an epidemic that has hit a critical point in our Commonwealth and especially in our city. So I am proud of the work that everyone that is here tonight is doing to stop people from dying. And the efforts that people have made have been incredible. I am a little discouraged that there's not more community involvement, given the fact that there was so many concerns about the office opening up. But I hope that people can now maybe look to the video that's going to be provided through Revere TV, and hopefully they can answer some of the questions that some people have. And it's funny because we actually had, Julia and I sat down today with a college student who had some questions and was writing an essay on the opioid crisis. And I brought up the fact that we have this new office on Revere Street, and he said, "Oh, the methadone clinic." So the level of communication that the city has is important. The fact that we're giving folks information about what exactly is going on is important, and I think the show of support in city staff, our public safety officials, and folks who are involved in the community is important. So I just want to thank everyone for taking the time to be here tonight, and I hope that any of those who do watch and have any questions or concerns, feel free to come to my office or to talk to me directly or to Julia about any of the operational questions that they might have about what happens on Revere Street. Thank you.
Thank you. So I'm going to start at my left and introduce the panel that is here tonight. Or actually, you can introduce yourself and your title and role.
Sure. My name is Amy O'Hara, and I'm a lieutenant with the Revere Police Department.
My name is John Goodwin, and I'm also a lieutenant with the Revere Police Department.
Nicole Silvestri, Site Initiatives Coordinator.
Hi, Carrie Ann Salemi, peer specialist.
Good evening, Kim Hanton. I'm the Director of Addiction Services for North Suffolk, but I'm also the Health Coordinator for the City of Revere and the SUDS Initiative.
Hi, Chris Bright, Fire Chief, here to help and facilitate any way we can.
Hi, Kevin Doherty, Outreach Director and Coordinator for the City of Revere Fire Department.
Thank you. So I'm going to ask Carrie Ann if she wants to tell us a little bit about her experience and why it's important to have these types of services in place in the city based on her journey.
Hi, everyone. Good evening. Julia asked me to speak a little bit about my experience. My experience is I am a person in long-term recovery. I have an addiction issue that will be with me for the rest of my life. However, I've been in recovery for over 15 years. And I've been working with people who are currently using, that are in treatment, that are in recovery for over 13 years. So this issue is very important to me, especially in the community. I have 2 children, one that is in middle school and one that is now in college, that have seen what's gone on in the city and the epidemic that's happening. And, you know, when I was using drugs, I think about how lonely this illness is. It isolates you from the people that love you, from your community members, from everyone in general. So with that being said, it keeps people feeling alone and not asking for help. I think that to know that we're talking about this, we're finally talking about what's really going on. This has been an issue for many, many years, but it's been kept a secret. It's a shameful illness. The person who's addicted is ashamed, the family members are ashamed, the community members are ashamed. And And it's a very, very sad thing. And I know that we need to do something different. We need to help these people. We need to let them know that we care. You know, this disease is definitely a behavioral disease, which, you know, the stigma on drug users is that they're criminals or that they're homeless or, you know, the many different things that you've called a drug user, if you think about it. The person that's, you know, sitting on the corner asking for change, and you walk by and you judge them and you roll your eyes and you said, oh, you know, this city's going downhill. You know, that's stigma. You know, we're not helping these people. We're making them feel more and more ashamed. We're keeping them in their active addiction just by that disgusted look, just by that, you know, ignorance to this illness. And so things need to change, you know. The language needs to change. We need to stop calling them junkies and losers and scumbags. We need to start calling them human beings, because that's what they are. They're human beings. And they're sick. They're not bad. And I was very sick. And today, I'm a community member. I'm a mother. I'm a daughter. I'm all those things that that person who's still using drugs is. And I'll be just like them for the rest of my life. However, I found a different way because there were people that were willing to help me, because I could not do it alone. You cannot get better on your own. And as Julia said, there's many facets to recovery, and there's many different options, and not one way works for everybody. And no, they can't just stop. Why can't they just stop? That's the question that everybody asks. Because it's an obsessive compulsive disorder, and you can't just stop on your own. So the more we educate people on what this is really about, and the more people they see that are living healthy, positive lifestyles today, that were once that person on the corner asking for change, then you'll see the miracles. You know, there's many, many miracles in this community, in this state, in this country. But we've been taught, I've been taught, in my own personal journey of recovery, to keep it anonymous. And I thought that that was what I was supposed to do, so I didn't share that my experience or my journey. Today, I'm no longer anonymous. I'm not ashamed of who I am. It's taught me how to be strong. It's given me courage. I never in a million years would thought that I'd be able to speak and talk about this issue in public, because I was told that I need to keep it a secret. Even in 12-step meetings, you know, you're told to be anonymous. And I don't believe that anymore. There's too many people dying alone. They're alone. They're being found in bathrooms alone because of the way the world sees them and the way they see themselves. They already feel bad enough about themselves, you know? We just make it worse, and we keep them sick. If we open our hearts and open our hands and smile at them, offer them a hug, offer them a cup of coffee, and not judge them, makes a world of difference. And that's what we're doing at the drop-in center on Tuesday nights, is we're there as a resource. When I said I'm a peer recovery specialist, what that means is I'm just like them. I'm not their counselor. I'm not their probation officer. I'm not, you know, their scolding parent. I'm them, and I'm just like them, and I treat them like a human being, and I meet them where they're at, and whatever they decide. See, this disease has taught us that other people need to make decisions for us. that they need to tell us what's going to work for us. You need to go into treatment. You need to go to jail. You need to go on the methadone clinic. You need to. You know, that's what people do to us. And it's about time that we learn to let them make their own decisions and find their own path. If we allow them to decide what's gonna work for them, that's when they start their journey and their process into recovery, and whatever recovery means to them, not to what it means to me. Because I can't push my recovery on somebody else. All I can do is be somebody to listen, somebody to care, and help them in any way that I can to help them to get to that next step, to make the next positive move. Because any positive change is a good thing. And the more we encourage people for any small positive change they make, then they start to make more positive changes. And that's how it works. You know, bottom line, that's how it works. And so on Tuesday nights, we provide resources. We do outreach with the fire department and the police department. We train people in Narcan, especially family members and parents, so that they can save their child's life, so that they can have a chance to find their own recovery. And we're just there for someone to talk to. So thank you for letting me share.
Thank you, Carrie Ann. So this portion of the meeting, we're going to ask if people have any questions. If you could come up one at a time up to the podium and state your name and your question, and I will try to field it to whoever is the appropriate person to answer.
Just if you could, for the viewers at home, let them know the phone number, information to contact the office.
Yep. So our brochure is up here if you want to pass it out to your constituents. We'll also put it up on the city's website, but just so you have it, the phone number for the main line is 781-629-4158. Or if you don't feel comfortable calling and you just want to leave an email, you can at sudi@revere.org. And both that voicemail and that email will be checked on a daily basis, and we'll make sure that somebody gets back to you if you have any concerns or if you are just looking for support. So feel free to call or email either of those contacts. Do we have any questions from the audience or comments, concerns? Come on up. Thanks.
Oh, I'll break the ice. Hi, my name's Paul Kuziak. I actually don't even live in Revere. I live in Beverly. But I'm here this evening because I'm the proud dad of two sons who struggled with addiction to prescription opiates, which led very quickly to heroin. And all I can describe it at its worst is our family's own private 9/11 spread over many, many years. But I'm one of the lucky ones. I'm fortunate. My youngest son, who entered treatment at 16, is now 29 years old, and he's been doing well for nearly 10 years. And my oldest is now 33, and with the exception of a slip about 5 years ago, would have been doing closer to about 8 years. So that propelled me to get involved in removing the stigma, as Julia and so many people mentioned here this evening, because you know, that's a huge barrier that is holding families back from seeking treatment early and often enough. And I really, I should say before I forget that I'm also a parent volunteer with the Partnership for Drug-Free Kids, part of a national support network. And I've been with the Massachusetts Organization for Addiction Recovery, more on their board for about 10 years, although I left there in January. But it is, it's just so awesome to see a community like Revere come together. This doesn't happen everywhere. Too often, communities operate with lots of good things going on, but in their own independent little silos. There's just no coordination of efforts, not nearly as much. And so I look around and I see two people from the from the police department here, two lieutenants. You know, there's Julia's staff. There's a person actually at the table in long-term recovery, you know, sharing, you know, their strength and hope, and that peer-to-peer connection is just so incredibly powerful. And Kim Hanton I've known for a lot of years with North Suffolk Mental Health and everything that she's done in Revere. Julia for probably, 8 years now. And again, having a mayor at the table who genuinely gets it and wants to do this. And then you have, you know, fire department, first responders here, and other people that I met here in the audience from the community that are doing all sorts of things with a holistic approach, the school system people. So I guess what I'd say to the community members, you know, who aren't here but are maybe watching this at home, from where I sit, you are fortunate to have some of the most kindest, compassionate people you ever want to meet in your community to tackle something that is literally, you know, tearing families apart. So I hope you not only don't fear what they're doing, but you embrace it, because if you do, I think in time you'll find that they are literally saving lives, a team effort. And as a result, more families will heal, and more young people, like the young lady who shared here earlier, will have a chance to go on and realize their, you know, tremendous potential. And so on behalf of the Partnership for Drug-Free Kids, as Julia knows, all of our resources are free, you know, for families, and there's lots and lots of things to complement all the awesome work you guys are doing. So I'll shut up now, but thank you very much for the opportunity and everything you guys are doing.
Thank you.
Paul, I just want to thank you for sharing your story. You know, law enforcement is on the front lines in this issue, and your family is exactly the type of family we come in contact on a daily basis. And this is where the drop-in center is very valuable to us, because if I were to speak to you at a call, or if we came in contact with each other, I have also resources that I can offer you. And we would refer you right to the drop-in center with people that are sitting here today, and they're very valuable, and it helps reduce the stigma and let you know that there are resources available.
Thank you. Hi, you want to come up?
Sure.
Thank you.
Dan McGuire, 114 Pearl Ave, proud school committee member. And I'm proud of the mayor and the police and fire, because it's my school committee and mailman had been asked the questions. Dan, my son, my daughter, my aunt, my uncle have a problem. Where do I go? What do I do? Thank God we have a place like this now. And it's not just for the addicts. It's for that mother who's crying at the table to go and get the help that the son or daughter needs, or for that aunt. And this affects elderly, this affects youth. So thank God we have a place that I can recommend. And I'm just so proud of the effort. So keep up the good work. Thank you.
Thank you. Are there any other questions or comments?
I am firefighter Kevin Doherty. I would just like to reiterate what our teamwork, our collaboration, and what our efforts actually have now done as a city, and the expansion on the way this program is now running through our mayor and through my chief and the police chief and the lieutenants on the other side, is that when we are now at the table, we're working with teamworks with North Suffolk Mental Health, with people in recovery, people that were trying to get into recovery, and this is just a collaboration on more different ways to help people. That's what our whole essence in life is, to try to be and do, is be good people and to try to help others. I know since myself and the police department go to homes, we're not just picking people up on the streets. We're not just responding to Dunkin' Donuts. We're going to people's homes. Through our partnerships and our collaborations, we are now visiting those homes where people overdosed. And there are countless homes that have reversed their son, their daughter, their mother, their father with Narcan, that we have been able to seek out the person who was using that heroin or that opiate and give them that Narcan that saved their child's life. We're here to help people change their lives, and I couldn't tell you the countless amount of people that stop myself or other members of my department that say thank you. Thank you to your team. Thank you to Gary Langus, who is our harm reduction specialist, to Kerry Ann, that opened the door to say there's ways to get help. There is a solution to your problems, and to any specific problem, just like myself, I've had problems. The mayor has had problems. We've all had problems. There's always a solution to get help. We are just giving out some information on different ways to get a solution to a problem that they might need, whether it's opiates, alcohol, drugs, or maybe they need the phone number for the DPW. They can stop at the SUD office and they can get that number as well. They can email myself at kdoherty@revere.org. They can call my cell phone. As a municipality, we just try to offer help. We are now in the preventative stages. We're not just going after the people who have overdosed and have been administered Narcan. We are now working with the police department and their analysis to now start a prevention program. We're now working with the Revere Public Schools through the mayor and through the SUDS department on working a collaboration to actually be members within the school departments are going to be working with us to start a preventive program or to offer help to children who suffer from issues of addiction, alcoholism, through family members. We would have never been able to get to this if Revere wasn't a forefront on addressing this problem. The problem is out there. It's in, like the gentleman said, Beverly. It's in Lynn, it's in Revere, it's in Boston, it's in Wellesley. Our program is now in over, I believe, 17 communities. Communities from, I think the last one was the Canadian, a suburb in Canada just reached out to us to get our program, the City of Revere's program, on ways to get help and help other people. So Revere, this may come with a couple of ruffles and it'll be a work in progress, but if there's a question, there's more than enough people that are out there that can answer your problem. You have a problem, we have a solution. We're just here to help people. And I'd like to thank everybody, and they can always shoot us an email. Come to Tuesday nights, with the office is open during the days, but every single Tuesday night, we actually have a firefighter and a police officer at that office right now to represent the city municipality on ways to get help. We didn't just cancel Tuesday and Thursday nights because we tell people to come on a Tuesday, Thursday night. They might not have anybody knocking at their door tonight. But if they do have someone knocking at their door tonight to possibly get someone into treatment, that name will be left for Kerry Ann. They may be trained in Narcan, and that Narcan could save one individual. Our program is stars above everything else, and I feel that that's what we're all here for. Thank you.
Thank you. Is there anyone else on the panel who wants to say? Start with Lieutenant Goodwin and then Kim.
Thank you. I just want to add, we see these bumper stickers around with Revere Pride on it, and this city has a lot to be proud of when it comes to, the battle against opiate addiction. 10 years ago, when it started to show its ugly head, we were probably one of the only communities around that was properly reporting the data on overdoses. And I'm comfortable saying that, and I think that went a long way to spearhead the public awareness that we have now. I'd like to also add the Narcan program that the fire department has, one of the first in the country, and we're part of that, and we're proud to be part of that. That program has resulted in what's being reported by the governor's task force as a 60% reduction in fatal overdoses in the city of Revere. 60%. That's certainly a victory. We have a lot of work to do. This is just the beginning, but to save lives is certainly our first priority, and I think that's obviously been successful. This initiative is really a way of formalizing relationships that have existed informally. I've worked with Kim Hanton for 20 years, trying to provide people with detox or recovery treatment programs when they wanted them and needed them. And it was difficult, but this initiative is really just a way of formalizing those relationships and hopefully getting to more people and saving more lives. You know, the police department knows our primary role is certainly enforcement, and that's what we do. You know, we do our best to keep drugs out of the neighborhoods. We've increased those efforts through the years, and I think we've had some success. But we know that we can't arrest our way out of this problem, and that we need this partnership. We need treatment. We need prevention. You know, we need those programs. And this initiative is just a way, again, of just formalizing that relationship and providing more access to those programs. Thank you.
Thank you. Kim Hanton?
Hi. I just want to comment on the disease a little bit, because I think it's really important that people have an understanding. I've been doing this work in this community, unfortunately, for 30 years, Johnny, but with Johnny for 20, but 30 years I've been working in the field of addiction. And so for me, to be sitting here, you know, talking to the community, it's not the first time. This face is not something unfamiliar to the community when it comes to working with the disease of addiction. But what is new right now is people's initiative of really taking a stand and really it becoming an important piece for people. And I thank the mayor, I thank Julia, I thank the police and the fire, because I think it's really important that we as a community stand tall, because this disease is not a disease of isolation and alone. It wants to be alone, it wants to be isolated, but it affects your entire family. It affects your entire neighborhood, the community, the school, the place where people shop, where people go and get their hair done, their nails done, wherever you work, the disease is there. So when we talked about coming out here this evening and really taking questions for people that had concerns and fears, because I don't want to underestimate that. I want it to be a reality. I get it, I understand it, but there has to be a transparency. We are here, we're welcoming questions, we're welcoming people to really kind of question what we're doing. We want to be honest, we want to be transparent about exactly what we're doing, but we want to understand your fear as well. And we can't do this without you. We need you, Revere. We need this community to back the work we're doing, because we need you to trust us. We need you to come to us, we need you to question us, because then we can give you the answer. We can let you know what we're doing, we can let you know where we're doing it, and how we're doing it. It's really important that you ask and you don't walk away saying, oh, you know, that's what's going on there, or, you know, they're doing this. Come and talk to us. Come and hear what we're doing. Come and question us. We're there for you. That's the work that we're all public servants at this table. We do the work for you. Thanks.
Thanks, Kim. So I just wanted to see if there's any other questions from the audience. Anyone from the panel? That's it? Nicole?
I just wanted to follow up about the prevention that Kevin had mentioned. Revere is one of 16 communities in the state that is the recipient of the Partnership for Success grant. Basically, that's going to be working on the prevention of prescription use amongst high school age students, and we're going to be working with the school system to implement that, as well as supporting the school system to implement the state mandated SBIRT, the screening, brief intervention, and referral to treatment, which is 7th and 10th graders, and it needs to be implemented in all public schools, I believe, by 2017. So as Kevin alluded to, we're going to be working with the schools for the prevention through the state funded grant program.
Thank you. So I believe we're going to wrap this up, but I just want to, you know, piggyback off what everybody mentioned here tonight and say that the work that we do at the SED office is for the community, and our doors truly are always open. We are open to feedback, suggestions, and like Kim mentioned, we need input. The only way that this work is going to be sustainable and effective is for community involvement, because nobody knows the community better than the community members. So please, if you have any questions, feel free to call our office. Our number again is 781-629-4158, or you can email us at sud@revere.org, or just pop into the office at 437 Revere Street. We're right next to Billy T's, so you can go enjoy some Chinese food afterwards if you like. And we look forward to working with you soon. Thank you.